Interpreting drug orders. Interpreting drug orders is an essential skill for all nursing and healthcare students. Accurately reading and understanding medication orders is a key part of safe patient care, helping to prevent medication errors and ensure the right drug is given in the right dose at the right time. When reviewing a drug order, it's important to pay close attention to each part of the order. A typical medication order will include the drug name, dosage, route, frequency, and sometimes specific instructions or conditions for administration. You will also come across a variety of abbreviations in medication orders. These abbreviations might refer to dosage forms, routes of administration, frequencies, and instructions. For example, PO means the medication should be given by mouth, and IV refers to intravenous administration. BID means the medication should be given twice a day, and QD means once a day. While some abbreviations are widely used and standardized, it's always important to be cautious, especially with unfamiliar ones. You can see the comprehensive list of common medical abbreviations on the Learning Portal Nursing Math tutorial. Let's look at an example of a basic drug order. Pretend Med, 250 milligrams, PO, QD. For this review, we'll be referencing this mock medication label. In this example, Pretend Med is the generic name of the medication. 250 milligrams is the prescribed dose. PO tells you the medication should be given orally, and QD means it should be administered once a day. Once you've read the order, the next step is to match it to the medication label. Let's review what to look for when reading a drug label. 1. The trade name is the brand name under which the drug is marketed. In this case, the trade name is Pretend Med. 2. The generic name represents the active ingredients in the drug. In this case, fos-farmoide. Each medication only has one generic name, and it will always be included on the medication label, usually in parentheses beneath the trade name. 3. The drug identification number, or DIN, is a unique number assigned by Health Canada that confirms the product is approved for sale. 4. The form of the drug tells you how the medication is supplied. In this case, the medication is provided as capsules. Medication can also come in other forms, such as tablets, solutions, or suspensions. For oral use, eye or ear drops, or injections, topical creams or ointments, suppositories, etc. 5. The dosage strength is the amount of active drugs per unit. In this case, 250 milligrams per capsule. For solutions, the dosage will be listed as mg/ml or mcg/ml, meaning each milliliter contains a specific amount of medication. 6. The standard adult dosage is a reference guide for typical adult dosing, which can help you identify if an order seems appropriate. Often these dosage guidelines aren't printed directly on the label, but are included in a pamphlet inside the medication package. 7. The expiry date will always be listed on the package. It's important to check to ensure the medication is still safe to use. 8. Storage instructions. Some medications require special storage conditions. In this case, it is recommended to keep the medication refrigerated at 2 to 8 degrees Celsius and to keep away from light. Always double-check the drug label against the order to ensure the correct medication is being prepared and administered. Knowing the common things to look for on a drug label, such as the drug name, dosage strength, and special handling instructions, can help prevent errors like confusing similar drug names or misreading dosage strengths. Developing strong habits for interpreting drug orders and reading labels is essential for ensuring safe practice and building your clinical skills. To learn more about interpreting drug orders and common abbreviations, check out the Learning Portal Nursing Math tutorial.